the city. I'm Clover Frederick, your host. Human Papillomavirus, or HPV, is the most common sexually transmitted disease in the United States. So common that according to the CDC, nearly all sexually active adults will get it at some point in their lives. To learn more about HPV and what is being done to prevent its spread in our community, I'll visit with Dr. Bob Rauner from Partnership for Healthy Lincoln and Dr. Erica Peterson, a pediatrician from People's Health Center. Thank you both for joining me today. So Dr. Rauner, what is HPV?
Well, it's human papillomavirus, as you mentioned. It's one of the most common sexually transmitted diseases. The good news about it is there's a vaccine to prevent it. It started a few years ago. There was a vaccine that could stop 2 strains and 4, and now the latest one actually stops 9 strains.
Oh wow, okay. So who should be vaccinated to prevent the spread of the virus?
Well, the most important time to be vaccinated is during adolescence, so kind of ages 9 through 15. The main reason is that's before they would be exposed to it. You need to be vaccinated at least a year or 2, preferably, before you might be exposed. You want to get them as early as possible, actually.
Okay.
And then there's a great opportunity during the 7th grade physical. So since all kids come in for a 7th grade physical for school, well, that's a perfect time for the vaccine. It's right in the middle of when they should be vaccinated. And so it's a good opportunity to get them vaccinated.
How do vaccinations help?
Well, vaccines are a tool that we have in the medical community to help train the body to more effectively fight off infections. And so this vaccine in particular helps train the body to fight off HPV more effectively. If people are infected naturally, oftentimes their body doesn't fight off the virus very effectively, and that's what can lead to problems like genital warts, cancer down the road, those type of things. So the vaccine basically just helps your body to fight that and then prevent those problems down the road.
Now, how many vaccines are required for HPV?
Well, that's a really good question. It's actually changed recently. In the past, as Bob had said, we needed to give 3 vaccines to all adolescents to get that immunity up. And recent studies have shown that, especially in younger kids between 11 and 15, we can actually only give 2 vaccines. So it presents a good opportunity for us to protect them at a time that we really need to, without having to stick them with the vaccine 3 times.
So what are some of the most common misconceptions about the HPV vaccination and some of the biggest challenges for people to get around to getting them?
I think one is just remembering to get it in the first place, and that's why we want to take advantage of an opportunity at the 7th grade physical this summer to try and catch as many kids in Lincoln as possible. The other thing that now, because of the change in vaccine schedule, if you get it before 15, it's only 2 shots instead of 3, so shaves you the hassle of an extra visit, the pain of an extra injection, and the cost of the extra vaccine, and so it's an opportunity to get as many people vaccinated as possible.
I think, adding to that, I think a lot of parents really think this is a vaccine only for kids once they're sexually active. That they think when they come in at 11, my child's not doing any high-risk behaviors. And so I think that for a lot of those parents, they're hesitant because they think that may give their child permission to become sexually active earlier, or it's just an inappropriate time. And one of the analogies that I read, it's sort of like putting on your bike helmet if you're riding your bike. So you wouldn't want to do that right as you're crashing or when you see a car coming, but you need to think about that in advance. And that's kind of the way the HPV vaccine works, is that it's very effective when you do it in advance, but doing it after an infection has occurred doesn't help with that particular strain. So that's why we really want to try and catch them earlier. And so the other misconception that I have seen is that it's only a disease in women. And so I think a lot of parents of teenage boys have been hesitant because they think of it as only preventing cervical cancer, which it does very effectively, but it also prevents a lot of oral pharyngeal cancer, anal cancer, penile cancer, and genital warts, which affects both the boys and the girls.
Yeah, I think early on there was a misconception because it was initially marketed to prevent cervical cancer.
Right.
They don't forget that there are a lot more cancers than there's cervical cancer that it prevents. And the pharyngeal cancers are probably even more common now than cervical cancer, and so it prevents those as well. I know an ear, nose, and throat physician here in town, he says about half of the mouth cancer he operates on are HPV related.
Wow.
So we could prevent a lot of those. Part of this project too, we should probably talk, this is a community-wide initiative right now. We have all the pediatric clinics in Lincoln, People's Health Center, and several other clinics that are going to try to focus on this all this summer as a way to improve our vaccination rates.
Good. Do you have any personal stories from working with HPV vaccinations or even cases that you've seen that people should know about?
That's a really good question. It's, that's, I think, one of the challenges with preventative interventions is, if someone comes in and you've got strep throat and we give you a medicine and you get better, people see that and they can see the result pretty quickly. The results with this have been studied over time, but in an individual patient, it's really hard to see that result right away. So we have to just go by data, and you don't get that immediate feedback, which is one of the reasons I think it is a harder thing to explain or a harder thing to commit to for a lot of families, and just in preventative interventions in general. So hopefully we will have stories, but even down the road you won't know those cancers that never developed.
Right.
So, so we know the studies are there with populations, but individual patients, it's a little harder for me to get that information.
Although I'd say I actually know 2 people who have mouth cancer, probably was related to HPV. Just in my social circle, a colleague I work with, her husband was treated for this and had to have surgery and radiation therapy for it. I have another friend of mine whose older sister had this, and so the mouth cancers are more common than people realize, and those, had they been given this vaccine, 20 years ago, they would probably not have had those cancers. And so there's a long delay from that, and that's part of the, so one of the ways to solve this is just to make it this is just normal what we do at 7th grade, everybody gets vaccinated. Then you don't have to worry about that, but then you're preventing stuff 20 years from now, which is always hard. For the personal story side of things.
Right. Now, what are the most common HPV-related cancers? You've touched on this a bit.
Well, the 2 most common are cervical, which is dropping because of pap smears over time, but the oral cancers are probably the next most common. I think in the order of around 15,000 cases per year nationally, and so there are quite a few. And then other areas just basically in the general region, so the penis, the rectum, all those things are close by. Those can also be have cancers that are related to HPV.
Now, I know with cervical cancer, the only way of knowing is through your annual exam. Tell me more about the mouth cancer as far as how would somebody even know? Is there symptoms or?
No, that's why you need the vaccine, because there really aren't symptoms until 10 and 20 and 30 years later that you have it.
And we don't have a screening test right now that we do routinely on people to look for that either, like we do with pap smears for cervical cancer, which isn't perfect, but is a lot better than.
Yeah, and then the unique thing about this is one of the pediatricians, the way he explains it to parents, Doug Ebers, he was saying, well, I wish I had a vaccine for lung cancer. I wish I had a vaccine for colon cancer. I wish I had a vaccine for breast cancer. We don't have vaccines for any of those cancers. But these cancers we do, and there's a vaccine, it's available, minimal side effects. We should get it.
Yeah, great. How does the U.S. rank in vaccinations compared to other developed countries?
Depends. Actually, for most routine vaccinations, we're behind a lot of developed countries, actually. Nebraska, compared to the rest of the country, we're kind of middle of the pack. Right now, about 50% of our kids are being vaccinated appropriately for HPV. The Healthy People 2020 goal, which there are a whole list of measures that we have national goals for, the goal is to get to 80% by 2020, and I think if we could take this on, might be able to get there a few years early, and we're kind of thinking maybe we want to make our goal 80% by 2018.
Great. Now, where can people find out more information about HPV or the HPV vaccinations?
Well, probably the best source is their provider. When they go in for the 7th grade physical or well-child checks, when they see their pediatrician or family physician.
And for those that want to come with a list of questions, the CDC website does have a lot of reliable information. I think I agree that using that information to ask questions then of your individual provider is probably the best way to get your questions answered. But the CDC does have some basic information as well.
Okay, very good. Well, thank you both for coming and educating us on this really important subject.
Thank you for having me.
When we return, we're going to learn about healthy eating from Lincoln Public Schools.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. For more ideas, visit healthylincoln.org.
Welcome back to Shape of the City. I'm Clover Frederick, your host. March is National Nutrition Month, and for many children, a key part of their nutrition comes from school meals. As many of us know, good nutrition not only leads to better health, but also better academic performance. So what are the latest methods Lincoln Public Schools are developing to offer both tasty and healthy meals to their students? Jessie Coffey, the nutrition specialist with LPS, is here to help educate us on these and other developments. Thanks for joining me, Jessie. How are you?
I'm great.
Good. Well, now, first, give us an idea of how many meals LPS provides every day.
We serve about 27,000 lunches, about 6,000 breakfasts, and about 3,500 snacks every day across the district. And so those are 5 days a week. And then in addition to the school meal program, we have what's called the Fresh Fruit and Vegetable Program, and that's offered at about 25 of our schools, the ones that are at higher free and reduced rates. And so we serve about 14,000 fresh fruit or vegetable snacks twice a week to those schools that are participating in that. And then we also have a separate program at Park Middle School that serves about between 100 and 150 children each night.
Okay. What are the biggest challenges in developing nutritional meals for that many students?
So as you can imagine, when we're serving that much food across the district to a wide variety of students with different backgrounds and taste preferences, it can sometimes be challenging to meet everyone's taste preferences. You know, if you make chili at your house and I make it at mine, it's going to taste different. Mm-hmm. So trying to get all the students, our 40,000 students, to like what we have. Sometimes it's a challenge, but we've been working with students to do taste testings, and they kind of are providing some feedback through our new online menu system about the different choices that we're offering. So we're really trying to get their input and buy-in with the meal options we have.
So the USDA has new standards for school meals. What's changed?
So about 4 years ago, they implemented new standards for the lunch program, and basically they just took a look at some of the latest science with the dietary guidelines, and they tried to align the school meal program with those best practice nutrition guidelines. And so we went to a lot of whole grain products, low-fat milks, increasing fruit and vegetable offerings at the school meal level at breakfast and lunch, and then also leaner meat in our entree items. So those are the big overarching kind of changes, and really the nutritional requirements that we have to follow are really much in line with what the American Heart Association requires, because we also have to, as of 2 years ago, we had to have lower sodium options as well.
Okay, very good. Now, how can LPS help parents and students make more informed and healthy school meal choices?
So I think one of the most important things to do is school lunch today is not the school lunch that you probably had when you were a child. At least for me, I came from a small school district where we had minimal choices. We offer at the elementary level 2 hot entrees and a salad every day, in addition to 2 fruits, 2 vegetables, and then sometimes we have different kinds of milk, flavored milks and just regular milk. And then at the secondary level, they get 3 hot options plus a salad every day. So making sure you're aware of the choices. Sometimes kids will say, like, I can't find anything I like, but maybe parents aren't aware that there's all these options available. So they can utilize our new online menu system. It's called NutriSlice. It has all of the options available now online for both elementary and secondary, and even our early childhood program, and it shows all of the choices available for each day, as well as the nutrition information and allergy information for all of the foods offered.
Now, how can parents or students with a smartphone access a NutriSlice or the other menu options?
Sure. So if you have a smartphone or a tablet, you can download from the App Store on your device the NutriSlice app, and then just look for Lincoln Public Schools. And then once you've accessed it one time, then it allows you to kind of favorite your, whether you're an elementary, middle, or high school student. And then if you're only ever looking up lunch, it kind of keeps that on your phone for you. So literally it takes 10 seconds each day to kind of figure that out. We also have a Facebook page in Nutrition Services that you could follow, and each day that information is sent out via Facebook, the breakfast and the lunch menu for the following day. So you can follow us there as well as on Twitter.
Okay. Now, as a health professional, what kind of positive impact do you think the new standards are having?
We definitely see there's more of an increase in fruit and vegetable consumption at most of our schools with the increase in options. So before, when we had fewer options, you know, not everybody liked the things we were offering. So now children will have the ability to choose the things they like. So when they're making that choice, then they're consuming more as well. We did plate weight studies last year, and we were able to see that, especially with the vegetables, the students were not throwing as much away now that there's more choices, and there are choices that they're more of their favorite types of things.
Okay, and then as far as the NutriSlice app, what kind of positive impact are you seeing there?
So because I work a lot with students with special diets, diabetic students or students with food allergies, it's been very helpful for our middle and high school students to manage their own disease, kind of look that stuff up and make decisions on their own. And then it's been really helpful for parents to be able to have the ability to look at the allergens on each individual basis. So basically, our online menu system allows you to take your mouse or on your phone, your finger, and hover over the item, say hamburger on a bun, and it'll tell you the calories and as well as the allergen information, the carbohydrate count, all the stuff that you would want to know. So that really allows people a lot of transparency for families, for kids and parents to be able to see the type of food that we're offering. And just because it's a hamburger, that doesn't necessarily mean that it's an unhealthy hamburger. We have a lower fat version on whole grain bread, so it is a better choice. And without that nutrition information being public, people aren't able to see that without that. So we have that now. And then there's also the ability for students and parents to leave comments on whether they like the item, whether we should have it again. And we really do use that information in the spring of every year to decide when we're building the menus for the next fall, which items we keep and which items we don't keep. If students aren't buying it with us, and we look at sales data as well, if those are things kids are not buying, then we're not going to keep it on the menu because it's not something that it's not popular, so we're not going to bring it back. But if they leave positive comments on things, then that really helps us select better choices that are more popular with the students.
Okay, very good. Now tell us about the partnership between Lincoln Public Schools and Nebraska farmers.
So we have received a USDA Farm to School grant, and we got that about a year ago. So we're about a year into working on that project, and we have about another 6 months left. But we have tried to increase the amount of local food items on our menu. And so it just happens to be Nebraska's 150th birthday on March 1st. Mm-hmm. So we were able to partner with the elementary curriculum folks on having a local foods day on March 1st to celebrate the birthday. And so we're having smart chicken from Waverly. Mm. Our milk is provided from several Nebraska farmers into the Land O'Lakes company. And then we're also having locally dried blueberries and some local dressings. So those are our highlight items for our March 1st local foods day. But we've been offering local foods about once to twice a month this winter when there's some limited options. But for the start of this school year, we were able to do local produce just about 3 to 4 times a week. And we had melons and cucumbers, and when there was a lot of produce, we were able to do a lot. And then we're also working with Prairie Land to get milk in some of our high schools for the athletics participants so that they have the chocolate milk and the refueling with that. And then we're also working with the Yesha cheese folks to do taste testings of that across the district for health fairs and for our early childhood program. They get a cheese snack once a week, so instead of the regular string cheese, they're trialing out the cheese curds, and we've had very positive feedback so far.
That sounds cool. Where would you like to see the future of school meals going?
So I feel like we really do, I think, a great job of providing a lot of variety for students. Not all of our kitchens are created equal, though. I think some of our most of our newer buildings and some of even our older buildings at our secondary level provide a fruit and vegetable bar for students that really allows them that choice architecture where they can make their own choices. Like if they just want one apple slice and then some peaches, they can do that. Whereas some of our older buildings don't allow for that kind of fruit and vegetable bar concept, but I really feel like that's where we win with kids, is when we can implement those bars. So as we're moving forward, that's something that I know we're looking at trying to get in any building that we're remodeling, or as the buildings are getting built. The food service director is making sure to have those options implemented there so that students have that ability to choose those healthier options, and they feel more empowered to make those choices, not just at school, but hopefully at home as well.
Mm-hmm. So what advice do you have for parents to get their child to pick healthier choices when they're away from school?
So some students eat with us maybe 3 times a day, but by and large, most of our students, really only eat 1 meal at school. So parents are still the key role models in their child's life when we think about making food choices. And so we know that when parents model healthy eating, that it's more likely that children will adopt it. If parents are saying you should eat healthy, but then they're eating chips all the time, that doesn't equate to in a child's mind, that doesn't equate to making sense. So really remembering that you're that role model and you're kind of that food gatekeeper into the house. And so if you don't want your child to eat it, you don't need to bring it into the house. And working with your child to make healthier choices, having them go grocery shopping and saying, in the produce section, what do you want to pick out? What's something you'd want to bring home and try? And I know my kids like to try really weird stuff. Sometimes they like it and sometimes they don't, but that's okay. Finding out that you don't like something is okay, and it really takes between 10 and 15 times to try a new food before you really decide if you like it. So you're just really helping them be open to trying new foods and having new experiences.
Great. Well, thank you so much for coming today and telling us more about student nutrition.
Thank you.
When we return, we'll learn more about healthy programming at the Malone Community Center.
Kids, get off your phone. You need to pay attention to the road. Or else, there might be tar, or wet cement, or a car. Please, get off your phone, or you might end up with a broken bone. Your phone may seem like it's all that, but staying alive is where it's at.
Hi, my name is Regina Sullivan, and I'm the Health Outreach Specialist for the Malone Community Center. I'm here to tell you about some programs we have here at the Malone Center. First, I'll tell you about our early childhood education program. It's for ages 3 to 5, and they give children that age the tools to be successful in school. We also have our after-school program, which takes children ages 5 to 13. They're picked up from school, they do homework, they get a snack, and then they're taken home afterwards. We have the out-of-school program, which operates in the summertime. It's for ages 5 to 13. They come to the center, they do fun activities, they have a snack, and even field trips. We have the Joanne Maxey Senior Program, which is a collaboration with the Aging Partners of Lincoln and Lancaster County. They do health education, social activities, and have a nutritious lunch every day with the seniors. We also have a breast cancer outreach program, which empowers women to seek prevention and screenings, and it guarantees that all will receive a clinical breast exam if you're qualified. Domestic violence program gives survivors skills to have financial independence and to have skills to live independently. We also have 2 teen programs called the Talented 10th and the Strong Courageous Girls, which takes ages 12 to 18, and they're here to give those children the social and economic skills they need to survive and thrive. As you see, we have programs for all ages and abilities, so come on in and give us a visit and see what we might have for you. For more information on these and other programs, go to malonecenter.org or give us a call at 402-474-1110.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thanks for joining us. Until next time, get active, eat healthy, and stay informed.